What's up, everybody? Hope you're having a great day. I wanted to share with you my burger temple. This, in fact, yes, is a burger that I made online. But I'm not going to tell you how I did that. But I want you to understand the majestic process of eating food, of digestion, of breaking down the food and absorbing it and turning it into muscle and tissues and energy for you to move on about your day and enjoy my video. This burger temple means a lot to me, and I'm going to show you what it means to eat food and what happens to your food when it passes after your mouth. Here we go. This is a GI tract in summary. It's so complicated. People think when they're sitting around watching Love Island series and eating Twinkies that you eat something and it comes out your butt. They don't imagine what goes on in between. But it is so complicated. The mouth, whenever food touches your tongue or even you smell food, the brain secretes hormones to tell your stomach to rev up and start creating digestive enzymes. The food pipe, the esophagus, it's a narrow tube, but it is so complicated. It's not just a tube. It has nerves and muscles, and things go wrong in the food pipe. Sometimes people have food getting stuck in their food pipe. Sometimes you get strictures. Sometimes you get cancers. Sometimes your food pipe doesn't squeeze like a toothpaste tube and you get food stuck in your esophagus and it can't go in the stomach. Sometimes the tunnel between the food pipe and the stomach closes so things can't pass. So we have to dilate it and pop it open with a balloon. The stomach, if you mess up your stomach, you're screwed. The stomach is very sensitive. It also has nerves and muscles that need to squeeze so that your food propels and moves forward. After the stomach, you get into 22 feet of small intestine. The small intestine is a location where food and nutrients get absorbed into the bloodstream. There's no absorption in the stomach. The stomach just digests food. It breaks it down. The absorption process is in the small intestine. So there's 22 feet right there. After the small intestine, you get the large intestine, which is the colon. The colon doesn't necessarily absorb nutrients, but it has a very complex bacterial colony that needs to stay stable in order for you not to get infections. It's a complicated microbiome. The whole thing is a microbiome. We're all bacteria more than human. Remember that. And when your colon is operating, its goal is to absorb water from the food. So all that food, it basically vacuums up the water back into your body. That's why doo-doo and caca look like the way they do. Now, I want to share with you a few pieces. Here's an esophagus. This esophagus is showing you the different layers. You have muscle, you have nerves, you have outer longitudinal muscles, you have inner circular muscles. They all work in coordination. There's excitatory muscles that fire off and tell it to squeeze. There's inhibitory nerves that tell it not to squeeze. And you can see here the junction between the food pipe and the stomach. There's a sphincter. It's a valve. Sometimes this valve is closed too tight. Sometimes it's too loose and stomach acid goes back up north and you get GERD, gastroesophageal reflux disease. Sometimes it's closed too tight and you get dysphagia. You get a sensation of food stuck in your chest. Sometimes you can get cancer here and food doesn't go south. Sometimes all sorts of things can happen. Here's something interesting called achalasia. Achalasia is a problem in the nerves of the food pipe, and there's different types. And the big picture is nobody knows why achalasia happens. They have suspicions, diabetes, opioids, nerve damage, but nobody really knows. There's a very complicated coordination process in the food pipe, like I mentioned over and over. But then sometimes the valve that I mentioned does not relax. There's inhibitory nerves that prevent this valve from opening up. Nobody knows why. And what we have to do is open it up. In addition to the valve not opening, there's times where the esophagus just dilates. It's not a normal tunnel. It's not a normal pipe. It just dilates like a balloon. It's a floppy esophagus. And when you eat, the food just kind of plops there. There's different kinds of achalasia. Sometimes we don't know what happens. Here's something called POEM, per oral esophageal myotomy. And what we do is we take the scope and then we dig a tunnel underneath the top layer, and then we chisel out the muscle that's contracted at the distal end of the esophagus. That way food can move forward. This is one way we fix achalasia, but this takes an advanced endoscopist. Not anybody can do it. GI, trust your gut reaction. The problem is sometimes when you open up this valve, all the stomach acid starts going up north, and then you have a new problem, which is the opposite of your first problem. Here's how we diagnose achalasia. You put a little meter through the nose down into the food pipe, and it starts making calculations. And these calculations are very complicated. This is called high resolution manometry, and it tells us the pressures at the different locations of your esophagus. And it tells us what type of achalasia you have, or if there's even any achalasia or problems with your food pipe. And as you can see, this ain't geometry, you know what I'm saying? This is complicated. It takes time to understand this. Even get GI fellows, we need to spend 3 years plus learning how to interpret these. But I just wanted to share with you a primer on what's the esophagus and the GI tract in general, and how many things can go wrong. This is just one diagnosis, and we see pages and huge landscapes of problems that occur in the GI tract. Let me know what you enjoyed about this, and remember your burger temple. Next time you eat a burger, if you have achalasia, just know there's some treatment options. But if you don't have achalasia, thank God that you can enjoy your burger temple. And the body, at the end of the day, is your temple. So treat it right. Med hustle, gut reaction. Trust your gut reaction. Peace.